Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yoon at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a briefing as we wait, South Korea reported 428 new cases of COVID-19 on Wednesday, climbing back above the 400 mark. Of the new cases, 411 were locally transmitted. Now we take a look at the briefing.
코로나19 대응 방안 등을 설명하겠습니다.
Let us now begin our regular briefing for March 24th, Wednesday. As of today midnight, we have 411 new local infections and 17 new imported cases. Yesterday, we had 3 more fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And in relation to the inoculation, yesterday alone we had about 20,000 vaccinations, and starting from February we have about 700,000 people receiving their first dose of COVID-19 vaccines. And yesterday we carried out some 74,000 tests nationwide. And as for the medical capacity response, here are some updates. We have had some 300 people with severe or critical conditions in early January. However, this has dropped to about 100 mark. And we also have about 600 beds for the intensive care units. And also we have much room for the hospital beds for patients with mild or moderate symptoms, with about 10,000 hospital beds available. And we also carried out our meetings with the local governments of the Chungcheong area, and we have been looking at some exemplary models. First, in Chungnam, we also have some cities there which is also carrying out intensive quarantine measures, as it is the city of Cheonan is highly populated and it is closely located to the capital area. And the city is also carrying out intensive and massive the testings, and also it carried out about 11,000 tests preemptively at 22 facilities that are prone to virus infections. And they also set up makeshift testing centers whenever they had large cluster infections, and encouraging and also enabling people to get tested as soon as possible, regardless of their nationality and so forth. And the Association for Medical Doctors, they provided and mobilized more doctors to the scene, and they also mobilized interpreters to the scene so that they could help out with those who have a language barrier. And the city of Cheonan also, in order to carry out a smooth inoculation of the COVID-19 vaccines, they have signed an MOU with major organizations. And also next, Daejeon Daedokgu district, it also has contained the spread of the virus to a large extent, and it is also vitalizing its local economy. And it is cooperating with the local police agency, and it is looking at about 3,600 multi-use facilities, including PC rooms and singing karaoke's. And also they are looking at ways to promote and stimulate more consumption at traditional marketplaces, and they are also providing more support for SMEs and micro business owners. And another example is Chungbu Province, Cheongju City, and in line with its spring festival of blossoming of the cherry blossoms, they also have a massive ban on those major businesses which are also going to operate during this season, and it will also intensify its quarantine inspective. And at the city of Cheongju, they also had a family where they have been infected, and these were families of people with disabilities. And it also provided more support by mobilizing staff members so that they could provide special care. And the government is looking at also these measures going forward, and we will be picking out some exemplary models and ideas that are being carried out in the local governments. We will be sharing them to promote them going forward on a national level. And also, we have been carrying out a survey on about 1,000 adults here in South Korea, and we have been looking at their awareness of the social distancing measures. And about 87% of the respondents said that they are stressed out of the COVID-19 pandemic. And as a measure to alleviate such stress levels, they said that the web searching as well as reading at homes and also engaging in home training or working outside and taking a walk or stroll, they have mentioned that these are some ways to help them alleviate the level of stress. And we would like to once again encourage the rest of the citizens also to take part in these activities, as they can help you alleviate your stress levels. And as for those people who are also suffering from a high amount of stress or depression due to COVID-19, please contact our hotline for detailed consultation sessions. And we also have seen many respondents of the survey who responded that they themselves are abiding by the quarantine measures. And we have seen about 81% of the respondents who have been responded that they are complying with the gathering ban on private gatherings of more than 5 people. And about 83% of them also responded that there is a need to alleviate, to intensify, that is, the quarantine levels. And about 61% also said we need to also carry out continued quarantine measures. And we are also seeing a continued outbreak, and also 78% of the respondents said against this backdrop they agreed on the restrictions of the business hours. And also as for the 85% of the respondents, they said that these people who breach the measures need to be faced with stern measures, including indemnification clause. And about 3% said that also they have been inoculated, and about 84% of those who have received the inoculation, they said that they will encourage others, including their family members, to get inoculated. And about 68% of those who have not yet received their vaccinations yet, they said that they will comply with the quarantine, the inoculation measures going forward. And about 13% of those who said that they did not, they were not inoculated yet, said that they will not get vaccinated due to those risks and dangers that could accompany the vaccinations. And also, as for the AstraZeneca vaccines, please note that it is being inoculated worldwide by many people. And the EMA also recently noted that the AstraZeneca vaccine has no risks of danger as well, and it encouraged the vaccination going forward. And to this end, we ask the members of the public to also participate in the inoculation campaign proactively for us to reach herd immunity and return back to a normalcy. And we are also providing you with scientific evidence in a transparent manner, and we will also be disclosing the post-inoculation adverse responses in a transparent manner as well. Please note that this inoculation measure is most crucial in protecting the safety of yourself and your loved ones. And we are also continuing beautiful spring weather. We believe that there are many people going outside, traveling to look at the sceneries, and also going to the mountains for hiking. And please note that even if you are outdoors, please wear your face mask at all times. And also, please also refrain refrain from consuming food and beverages at crowded places. We also would like to mention that we need to contain the virus going forward. We also continue to ask you to wear your face mask and wash your hands on a regular basis as well. The government also will exert its full efforts to enable the public to return to a state of normalcy. Thank you very
질의응답을
much.
시작하기에 앞서서 정정 말씀 하나 드리겠습니다.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 428 new COVID-19 cases on Wednesday. This brings the accumulated number of COVID cases to 99,846. There have been 3 more deaths, raising the death toll to 1,707. We'll wrap up the coverage here and we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.